The stunning wide open spaces and geological wonders of the Four Corners region are home to generations of proud and resilient people, families dedicated to their ancestral land. While the land is breathtaking, it is also extremely isolated. Living conditions are harsh and poverty is rampant. 1/3 of homes lack running water. 1/3 of homes lack electricity. 50% of the population lives below the poverty line. This is Utah. This is the Navajo Nation. Key and Frances Parrish were born and raised here. Their lives are rich in culture, community, and family, but poor in resources and basic services, including running water. Yet they've managed for decades, raising their livestock, tending to their homes, raising their family, until cataracts robbed them both of their sight. While most of us know that cataracts, the clouding of the lens of the eye, occur with age, few realize that blindness due to cataracts occurs with poverty. The parallels between the eye health needs of Native Americans and those of the developing communities the Moran Eye Center supports around the world are striking. Along with poverty, relentless sun, poor nutrition, and lack of access to eye care contribute to the high incidence of blindness in underserved populations. Loss of vision results in loss of independence, and that changes everything. When Key and Frances lost their sight, they stopped making the 14-mile drive over the bumpy dirt roads to the nearest source of drinking water. Instead, they drank from an old well that was intended for livestock. Even though this is the U.S., the utter lack of infrastructure, from paved roads to clean water systems, makes everyday living and access to health care an ongoing challenges for residents of all ages. Blinding diseases are prevalent, and the need for vision care is overwhelming. Yet here, in an area the size of West Virginia, there is not a single ophthalmologist. That's why Moran's global outreach team has been making the long drive from Salt Lake City to the Navajo Nation almost monthly for the past 3 years. By consistently showing up and bringing needed equipment and dedicated volunteers to them, we've established vital relationships with local partners and the community. We have worked hard to build trust with a population whose memories include a history of broken promises. The Moran Outreach Team performs eye screenings and surgeries and partners with the Utah Navajo Health Systems to train physician assistants about eye disease and to conduct thorough eye exams. Over time, these Navajo medical providers will be the eyes on the ground, working with patients with eye issues, referring complex and surgical cases to the Moran ophthalmologists, and helping with our post-operative exams. Meanwhile, 70% of the population needs eyeglasses. We've seen a family of 6 sharing a single pair. So many aspects of life depend on vision. Education, of course, is one of the most important. But schools on the Utah Strip of the Navajo Nation have the lowest performance rates in the state. Kids who can't see the blackboard or have trouble reading lose interest in school. Many disengage, both educationally and socially. Some drop out altogether. Now, with your support, we can provide prescription glasses for free for children and only $5 for adults. When you can see, you can safely build a fire, work, drive, read, cook, weave a basket, build a hogan. Since Moran's team performed simple cataract surgery on Key and Frances, the couple can once again drive to town for fresh water. They can once again safely tend their livestock and live independently. Vision changes everything. Our mission is to continue to build trust, train local providers, show compassion, and change lives. But we need you. They need you. Together, let's be the change.